morning, and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas in the studio today with Bill Kearney on a pre-recorded show. And Bill, let's see, you're in Tahiti.
I will be.
You will be in Tahiti, and I might be in Tahoe, and so we're putting them in the we're banking these for when we're gone.
Right. So you're going to be having to worry about the snow, and I'm going to have to be worrying about the sun. So.
Now, can you imagine if our bags got crossed up at the airport there? I ended up in Tahoe with your board shorts and tank tops, and you end up in Tahiti with my snow boots and snow gear.
It's just not going to work. We would have to. My wife just got back from Hawaii, and she had another fall, and anyway, she purchased a bunch of warm weather gear for me for Tahiti, and so I tried everything on last night because I've lost quite a bit of weight I used to buy extra large and extra large, and now I buy large or medium, and so they all fit.
Good.
And maybe when I wash them, they won't fit anymore.
That's always a real possibility.
It could be also a problem with the buffet on the ship. It's not serving.
You're going to be on a ship? We're taking a cruise, or
we're flying to Papeete from San Francisco or from Los Angeles, and then taking a boat around the different islands, Moorea and Huahine and Bora Bora and those. We like Moorea, and we've been there 2 or 3 times, and because I just don't know how much long my wife will be ambulatory, we want to be able to enjoy.
Now, when you go to these exotic, destinations, tropical destinations, are you the guy that's got, the flower printed shirt and the lei, and you wear all the gear?
And the Mai Tai.
Yeah, and the Mai Tai.
Don't forget that. And I'm, I try to learn the hula. And,
yeah. I mean, if you're going to go, you might as well go all out, right?
Yeah, it's just like TV. The little fat guy in the middle that's showing everybody how to do it.
Now, have you been to do they do I know in Hawaii they do the luau's and stuff like that, but what's the big thing in Tahiti? I mean, what is it that they do?
Well, we usually go to Moorea from Papeete. So Moorea is an island out in the middle, and you take like one of the San Francisco Bay cruiser things. You take that over to Moorea, and it's a small island, and we in the past have stayed at a resort there called the Bali High. That's a couple of hippies in the 60s went over there and really made it a resort for. And they're still alive.
Oh, wow.
They're old hippies now, about like me. And but the resort had been leased to the French own it, and these gentlemen actually got a 50-year lease on it, and the lease just expired a couple of years ago. So it was very economical to go there because you would have a hut-like thing right on the ocean, and you just step off a ladder and you were snorkeling, and but they kind of let it deteriorate some, and now some new owners have taken over, and of course it's like we're going to talk about today about some drugs. Once another owner takes over, it may have been way cheap before, but they will increase the price to whatever the level is today, and when you compete with Bora Bora and the Hilton Hotel and American International, it's not in my price range, but it's gorgeous. It just sits in a little cove there, and one time a few years ago when they had a tsunami, we were woken up at 4 in the morning by the gendarme going through the village saying, tsunami.
Yeah, that's some craziness right there.
So, the ocean, all the ships that are in the bay go out into the ocean, and then the water recedes and goes down, and so a lot of the fish get stranded on the sand, and then usually you go up into the mountains into some of the people's homes up there. we were told by the people at the resort, don't worry about it, this isn't a big one, and it really wasn't. But one of our group picked up a poison fish and got jabbed with the needles, and his hand really had swollen up, and those the kind of things you have to look for when when the water starts coming back up. Then the fish go back down into the water. They will eventually get there, depending on how long it is. So, but it was kind of exciting to be part of that. In fact, I think our up in Eureka and in Hawaii, it got hit much harder than it did there. And I can't remember where it originated from, but anyway, kind of exciting, and it's always about 80 degrees there, and the water temperature is about the same, and lots of coral and fish to snorkel around, and to see some of the other, like Bora Bora. We couldn't really afford to stay in those huts that are on the water there, but if you're on a ship, you just go back to the ship that night and then go back out the next day and snorkel around. The water's just crystal clear, and you swim with the stingrays and you swim with the sharks. And so if I come back missing an arm or a leg, you'll know that I wasn't in the Olympics. I was in the tropics. So anyway, it's going to be good to get away and take the plunge into the waters of Moorea and Bora Bora. And speaking of taking the plunge, we did take the plunge for Special Olympics a few weeks ago, and it was a lot cooler, the water was, than the water will be in Tahiti. So it was 40 degrees instead of 80 degrees, and we raised, I think, about $23,000 for Special Olympics, or maybe even more. It could have been 25. The chief of police of Lakeport, Brad Rasmussen, was at a meeting I was in this morning, and he told me they made more than what their budget was going to be for the full year. So we're happy about that. We've talked a lot about vaccines on this program, and one of the problems that we have with people getting vaccines is there's a portion of the population that just doesn't believe the millennials. A lot of them don't believe in getting a vaccine to prevent a disease. And there was a event that had taken place. It was a myth that was example of a fraudulent science that came from the British Lancet, which is a journal, a medical journal. It's published in Great Britain. And Andrew Wakefield, who was a former British doctor, falsely linked the MMR, the measles, mumps, and rubella, which we were talking about the other day on the show, to autism. And that paper eventually was retracted by the co-authors, and the journal Wakefield was delicensed by the medical authorities for his deceit and callous disregard for children in his care. It took nearly 2 decades for the immunization rates in the UK to recover. And by the end, UK families had experienced more than 12,000 cases of measles and hundreds of hospitalizations, and many with serious complications and at least 3 deaths. Now, you don't think of people dying of measles, but stunningly, that myth still persists. It was amplified by the British media during its early years, and later by celebrity endorsements, and more recently by the media. And he has continued his own relentless personal campaigning, moving well beyond the initial MMR vaccine, scaring people into attacking the CDC, the Center for Disease Control, in his controversial film, Vax. The film was pulled because screening at the Tribeca Film Festival found its way to independent theaters in the U.S. and Europe, and there's been a 4-fold increase in measles cases and 35 measles-related deaths just in 2017, and that is mostly because people were not getting vaccinated. There has been a resurgence of measles with more than 2,200 cases reported in the 2015 outbreak. If you remember, that came from Disneyland in California, which eventually affected more than 130 people, to the 2017 measles outbreaks in Minnesota that we talked about the other day, where the message persuaded many parents not to vaccinate their children. And then the autism myth also prompted an alarming number of millennials. And for those of you who are my age and may not know who millennials are, that's the generation that came of age in the era of this misinformation. So in the U.S., not to vaccinate their children was part of that myth, and especially autistic kids. And the reluctance does not apply just to measles. It's flu. Flu kills 100 to 300 children under the age of 5 every year, and up to 85% of them were not vaccinated when they died. So you wonder what it will take to protect parents and children from that kind of fraudulent science. Remember, that was just a myth that this gentleman exploded in the medical journals to prove that he was better than anybody else. Trust is vital for people to accept health interventions. The messenger can be more important than the message. The advice of the healthcare providers, families, and friends is often more influential than the cold facts of official sources. And to magnify this a little bit, just think about the amount of times that I've been on the air telling you avoid this drug because of this, and maybe 6 weeks or a year later or 5 months later or such, we will change that idea, just like the blood pressure guides that we told you 3 months ago had changed to be less strict, and then a month ago they came back and said we were mistaken. You would think before they publish something like that, they would verify the effectiveness of the information that they're putting out. So, second, the medical community must redouble the efforts that we put out so far to ensure the integrity of its evidence, and it must move rapidly to address fraud. Wakefield, the scientist, was not disciplined by the UK medical authorities, nor the article was not retracted by the Lancet until 2010, despite a lot of concerns. And that raised experts at the time of the publication and the 2004 expose on this doctor. Third, print and broadcast media have a special responsibility to provide clear, evidence-based reporting. And nowhere is that more timely than in today's world where it's instant reporting. Just think about the school shooting the other day and how the events of that changed as the length of time the press had been available at the scene to report actually what happened instead of what they heard that happened. The decline in MMR, that measles, mumps, and rubella vaccine that we talked about the other day, following that article was accelerated by the United Kingdom media, despite increasingly strong evidence refuting those claims. Conversely, there was an attempt by the medical community to recover from that impact that was catalyzed by the 2004 reporting. And the truth eventually wins, but we have to be committed to telling it. The fourth thing is the state officials must ensure the public health policies are enforced as intended. The rise in measles vaccines, or measles cases in many states, resulted from the loosening of immunization requirements for school entry. California is the only state that raised its coverage by enacting stronger vaccination policies to curtail such exemptions. Now, California, if you go to a public school, you have to adhere to what the protocol is and the regulations are for vaccinations to protect the rest of the community. And then finally, in an age of social media, there is frequent distrust, and authorities and increasing epidemic threats. Parents and educators have a vital role in helping children from an early age learn the skills of critical thinking. Over a century ago, Mark Twain, which I'm sure most of you remember as an American writer, had said, "A lie can travel halfway around the world while the truth is putting on its shoes." And that has certainly been the case for this vaccine autism myth. As most of you are aware that listen to this program, I have a grandson that is autistic, and he is critically intelligent. And for a period of time, we had a hard time convincing the parents that that the MMR vaccine would not cause autism. Very seldom do you find a parent who's not the most informed individual you've ever met that has an autistic offspring or son or daughter. So, and they do everything they can to accelerate the learning process and not harming them. So it is a world now that fabricated science is plentiful and it spreads rapidly, and we must be vigilant if we're going to avert epidemics. What does the administration call it but fake news? Too much is at stake for ourselves and our children to not apply the lessons from the vaccine. Autism debacle to avert the long-term consequences with fake science gains traction and threatens the health and lives of everyone. We have that issue with mumps, with measles, with polio, with almost everything that you can imagine that's a disease, and with people thinking that they are much better off by having their natural immunity and not taking the vaccine that's going to prolong their life and their health. Yesterday I saw an article on the New York Times, and again, that's not my favorite go-to newspaper, but excuse me, sometimes they have articles that are very pertinent, and it does something to actually change what you've heard about things, and you put it in a different perspective. And in this case, Teva Pharmaceuticals, which is a big generic manufacturer, announced recently that it would begin selling a copycat version of Cyprine. Now, Cyprine was an expensive drug that was invented in the 60s. The news seemed like a welcome development for people taking old drugs that have skyrocketed in price. And Cyprine, which treats a rare condition known as Wilson's disease, gained notoriety after Valeant Pharmaceutical International raised the price of the drug to $21,267 3 years ago from $652 just 5 years earlier. Along with similar practices by pharmaceutical executives like Martin Shkreli of Turing Pharmaceuticals. This is a guy that made the EpiPen who was found guilty just last week. The story helped spark a national conversation about the high cost of prescription drugs, not to mention the congressional inquiries and federal investigations. So in promoting its lower cost alternative to Cyprine, a Teva executive boasted in a new release that the product illustrates Teva's commitment to serving patients' populations that are in need. Now, this drug went from $652 5 years ago to $22,000 or $21,267 today. When a generic manufacturer gets into a product, we are looking for a better cost alternative. What the release didn't mention is the price. Teva's new generic will cost $18,375 for a bottle of 100 pills. That's 28 times what Cyprine cost in 2010, hardly the discount that many patients were waiting for. Now, can you figure this out? Let me go back to a more basic drug, hydrocortisone. Hydrocortisone over-the-counter sells for $3.99 for a 30-ounce tube or a 1-ounce tube, a 30-gram tube. And you get a prescription for 2.5%. That's 1%. You get a prescription for 2.5%, and it costs about $25. The reason it costs that much is because it requires a prescription, not that it costs any more to make, not that it's any more expensive to package, nothing except it requires a prescription. So we had an individual today that couldn't pay for that, and it was going to be used as a rectal ointment for hemorrhoids as an anti-inflammatory. And the cheapest we could get it down to by offering a different brand, a generic brand, was $35, $10 more than what we had on the shelf, and that was made by a generic manufacturer. So despite efforts by the Food and Drug Administration to encourage more competition for drugs that have no generic alternatives, companies like Teva will charge as much as the market will bear as long as there isn't any competition. And even companies that come under intense criticism, like Valeant, can often neutralize the consumer upset through assistance programs. And that's what EpiPen has done. They're pretty much giving it to schools with coupons or manufacturers' copays. While those can lower the out-of-pocket expenses for patients, the programs stick the insurers with the bulk of the bill, which in turn can be passed on to consumers through higher premiums and deductibles. I had a lady today that, and this is early in the day, that before I ever got to the pharmacy, I met her in a meeting, and she was telling me that she had to transfer her drugs from our pharmacy, excuse me, to CVS. And the reason was the copay for the same drug was over $100 more from us than it was from CVS. Now, if you remember the other day, we were talking about CVS getting $456 for a drug where an independent pharmacy was getting $2.50, or at the most $25. Is that legal? Unfortunately, it's legal. Is it an attempt by chain stores to run community pharmacies out of business? Of course it is. It's about the bigger stores getting bigger. So what I told the person was, who's been my customer for years, I understand what you have to do. You know, everybody's on a fixed income. Nobody can afford to pay $100 more than they paid, and it's a special drug that needs to be watched as people take it. And the person was just very distraught about having to leave us. And you can imagine how that makes me feel. For an independent pharmacy that does as much for the community as Northlake Medical Pharmacies do, because we believe in the community, and then have a big chain store come in whose objectivity was to put me out of business, spoken from the regional manager's voice years ago when they came in, is disheartening to me. This individual that had been taking this drug had been taking Ciprine for a decade, 10 years, to treat Wilson's disease. And for those of you who don't know, and most people don't, it's a condition that causes copper to build up in the body, and then that leads to organ and neurological damage if not treated. Calling the generic price incredibly punitive, Mr. Copeland said his employer's insurance shields him from most of the drug costs, but he worries what would happen if he were to lose his job. Teva's slightly lower price, from $18,000 to $21,000, would make little difference to him if he were put in a position to have to pay out of the pocket costs. And the FDA, to their acknowledgement, to encourage more generic competition, published a list of off-patent drugs that have no competition and cleared a backlog of generic applications. But as this case shows, it often isn't as simple as adding a single generic competitor. By and large, generics work where there are multiple layers, but they have to have somebody that they compete against in order to make it cost-effective for the patient. David Maris, an analyst at Wells Fargo who wrote this week about Teva's generic subprime price, said when there's not competition, this is what you get. If there are just a few players, if the drug treats a small group of patients, as in the case with Wilson's disease, they'll try to make as much profit as they can. There were just 5,226 prescriptions filled for Cyprine, also known as a trietine hydrochloride, the first 3 quarters of 2017. Wilson's disease is believed to affect only between 8,000 and 10,000 people in this country, and some with conditions take other drugs that needed to be taken as well to curtail this drug getting worse, or getting this disease getting worse in your system. Generic companies, just like brand name countries, are for-profit companies too. And it's not surprising to me that they price the product at what they think the market will bear. And a spokeswoman for Teva declined to comment on how it set its price, but said the company considers a range of factors. If there's more competition and ample supply, the pricing will continue to fall. Teva, which calls itself the world's leading manufacturer of generic drugs, has struggled in recent years with management and lost sales of leading brand name drugs. And in a twist, with the failing prices or falling prices of many commonly used generic drugs, it announced a major reshaping, including cutting 25% of its workforce. So patients with Wilson's disease have been watching the arrival for a long time, and they had personally hoped for more of a discount. Not to be outdone, Valeant followed their move with the release of its own authorized generic of the brand name that they also dispense, and they want to compete directly with generic manufacturers without lowering the price of their brand name product. So their generic sells for $19,119, not much of a difference. So the list price for its generic did not reflect discounts that they negotiate with buyers. Congressional and federal investigations into these practices followed, leading to a plummeting stock and departure of the chief executive and major investors. I really don't know what to tell the patients in a situation like that. We hope that if other generic competitors enter the market, the price will continue to fall. You have to remember all the R&D, all the research and development, all the things that had to do to bring this drug to market initially has already been done. So it isn't going to be nearly as expected to have an inflated cost if you don't have to have that R&D done. And in addition to this drug, Daraprim, which was an old drug used to treat a parasitic infection, is still $750 a pill after this fellow who was just found guilty became a social media villain for his role in raising the price overnight from $13.50 to $750 a pill. The cost of the EpiPen is an exception in that trend. Its response to the outcry, which reached about $600 at its height for a pack of 2. Mylan came out with the cheaper authorized generic. A pack of EpiPens can now be bought for around $300 at a pharmacy we're not available to buy from their wholesaler. Has a changed brand name on it. We'd hope that something more would come out of it, but it's really disheartening to see that I guess all the way through time you realize that it's not that unusual for people to make a profit regardless of what it does to somebody else. And I'm not saying that it's bad to make a profit. What I'm saying is it's bad to make a profit that's substantial over and above when somebody is desperate for this drug to keep from dying. We're going to take a break, and when we come back, Paul's going to take a little health quiz with me.
I'm looking forward to it.
Hi, everybody. I don't know if you've realized it, but we are right in the middle of winter. My name is Bill Kearney, owner of Northlake Medical Pharmacies. When the weather changes, it may not be as pleasant to drive to your pharmacy to pick up your prescriptions. We may have the solution for you. We now have free delivery to Kelseyville, Clear Lake Riviera, Riviera West, Riviera Heights, Buckingham, and still to Lakeport, Lucerne, Nice, and Upper Lake. If you want your prescriptions delivered at no delivery cost to you, now is the time to transfer your prescriptions to Northlake Medical Pharmacies. Or bring in your new prescriptions and we'll take care of you. Whether the weather is cold and rainy or a beautiful day and you don't want to take that ride into the pharmacy, give us a call. Northlake Medical Pharmacies, with 2 locations to serve you, on Hill Road next to Sutter Lakeside Hospital, or outside the Bruno Shop Smart, 347 Lakeport Boulevard.
Have you received excellent medical care from a provider in Mendocino or Lake Counties? Hello, this is Mendocino County Sheriff Tom Allman. Why not rock your doc, nurse practitioner, medical assistant, nurse team leader, or patient advocate by nominating them for the 2018 Rural Health Rockstar Awards? Just go to ruralhealthrocks.com and nominate him. Winning nominees will be recognized at the 3rd Annual Rural Health Rocks fundraising concert on April 14th. Rural Health Rocks is a fundraising concert for family medicine education for Mendocino County.
In the last decade, more than 400,000 people died on America's roadways. That's 1 person every 13 minutes. Roadway deaths strike the young or old at any time of the year, at any hour of the day or night. And it doesn't matter whether you drive a car on a highway, ride a motorcycle or bicycle on a country road, or simply take a walk near traffic. Everyone is at risk. Since 1969, members of the American Traffic Safety Services Association have worked diligently to make our nation's roadways safer by providing the majority of roadway safety features, including bright signs and pavement markings, guardrails, and crash cushions. These are just some of the roadway devices that save thousands of lives each day. Since most of our roadways were built in the 1950s, there's so much more work that needs to be done to reach the ultimate goal of 0 deaths. Safer roads save lives. To learn how you can get involved, visit atssa.com. A public service message from the American Traffic Safety Services Association.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Tompkins Tax Consultants. John and Diane Tompkins have been serving Lake County since 1974 and have been a member of the Lake County Chamber of Commerce for 24 years. They provide services to many small businesses and individuals in Lake and Mendocino County. Their main office is located in Lucerne off Highway 20, and they also have a second satellite location in Lakeport at 576 Lakeport Boulevard. For more information, reach them at 274-1843.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back. You got a quiz for me today.
Well, I got a quiz, and it's
put on
kind
my
of,
thinking cap.
Yeah.
You know,
Yeah.
there's
Well-
certain days where I'm spot on, and some days I'm not even close. So
Well, it kind of happens to me. Sometimes I go to the wrong store.
just motor memory,
Yeah.
right?
Well, this one is a weekly health quiz out of the New York Times. First question is a study from Stanford Prevention Research Center found this approach was the most effective in controlling weight loss. Number 1 was eating a low-carb diet, eating a lot of fruit, counting calories, or focusing eating on unprocessed foods and cutting back on sugar.
Oh boy, the best way to lose weight, or
Yes.
you would think that you always want to count your calories. Would be my thought, but the eating of unprocessed foods I'm sure helps. I'm going to go with counting calories.
No,
No?
you had it right.
I had it right.
Yeah,
The processed
yeah,
food.
Unprocessed foods
Yeah.
seem to work whether participation followed in a low-fat diet or fruits. To learn more, read the New York Times.
Okay. Well, 0 for 1. See, starting
Yeah.
off.
Japanese people with diabetes found that all the following were associated with being overweight. Eating fast, skipping breakfast, going, eating a snack within 2 hours of dinner, 2 hours after dinner, and that's it. So eating too fast, skipping breakfast, eating a snack 2 hours after dinner, which would lead to more obesity.
Which would lead to more obesity. Wow. You would think that eating the snack, but I'm going to go with eating the snack after dinner.
I guess the question was, with diabetes, found that all of the following were associating with being overweight.
So it's all the above?
No, it was skipping breakfast.
Skipping breakfast, really? Why? Is that why I'm overweight? I never eat breakfast.
You should.
I should. I just don't have time. I mean, my
it's
routine doesn't allow it.
The question must have been, see, when I printed this out,
oh, gotcha. It didn't
overlap.
Yeah, okay.
Other typing on it. So evidently it was what does not lead to obesity.
Oh, gotcha.
And for diabetics, and skipping breakfast
does not lead to.
Eating fast does. Eating snack within 2 hours after dinner does.
Okay.
And eating fast.
So skipping breakfast does not lead to obesity.
I missed this one because they always tell you to eat breakfast. And if I do eat breakfast, a decent breakfast, I usually have 3 eggs and an English muffin or something. I'm not really hungry at lunch, and I'm not really that hungry at dinner. But if I don't, I'll eat anything for.
I've noticed that sometimes, when somebody brings in bagels or a donut or something like, donuts or something like that, and I eat it in the morning, that you're right. When I go home for lunch, I don't eat lunch.
Yeah,
you're right.
Okay, see if we can get through this one.
All right.
British scientists found that those who worked the night shift were more likely to develop this illness: Alzheimer's, Parkinson's, diabetes, or narcolepsy.
Wow. Those that work the night shift, I'm going to say diabetes.
You're right. I missed that one too.
Probably because they just sit there and eat all night or something, or
if you worked in a union shop the way I did when I was going to college, I was the only guy that was working the night shift, and everybody else was sitting around. That was 50 years ago. Let's see if I can figure out what this one is. Stress can hurt our ability to learn. It can help our ability to learn. It can hurt our ability to learn and remember. A study in mice suggests that this activity might counter the effects of stress on the memory centers of the brain. Gentle workout, vigorous exercise, resistance training, or all of the above?
All the above.
I said that too. I didn't do well on this.
No, I'm not doing too great either.
I got 2 out of 7. Vigorous exercise.
Vigorous exercise. All right.
Mice, these are mice we're compared to.
Sure, yeah.
Given rein to run showed richer connections between brain cells. They did not look any further to learn more. So those people who get a serious risk of pneumococcal infections caused by which drug? Statins, opiates, benzodiazepines, or antacids. These people that take this kind of a drug tend to have an increased risk of fatal pneumococcal infections.
And that's
statins, opiates, benzodiazepines, and antacids.
Statins. No, I totally am guessing on that one. I would have no idea. But what the antacids?
Actually, I guessed antacids.
Yeah, did you?
But it's opiates.
Opiates.
Never heard that before.
I never have either. That's very strange.
The form of conception has the highest rate of failure by implant, IUDs, pills, or condoms. So a higher risk of getting pregnant by
Oh, which is the most risky out of all
Yeah.
of them? Implants? What are IUDs? Those are the ones that go in the arm?
no, they go in the vagina.
Oh, do they? Oh, I'm gonna go with.
I think in the arm it'd probably win.
Yeah, I don't. I'm wondering. I'm just. No, I thought there was a birth control that went in the arm. There was a form of birth control that went in the arm.
Well, there's a patch.
Oh, is it a patch?
And there's an injection too.
Okay. I'm going to go with the IUDs. I'm guessing on this one too because I'm not a woman and I would have no clue.
I guessed on that one too, and
Yeah.
I guessed the same thing you did because I've heard of the failure rate.
Hmm.
But condoms are the
Condoms
worst.
still
I
the
guess-
biggest failure rate. Huh?
I guess if you don't wear them, they don't.
Well, yeah,
they
100%
don't work
failure
very
rate
well,
that way.
Well, I feel better.
I think I got one, so I think you did better than I did.
I used to do these all the time. I
Yeah.
used to read the New York Times all the time, and right after all those articles are in the paper
Sure.
today, in the New York Times today, and all it was is like the crossword
Oh,
puzzle.
you have to read the articles
You have
and
to
then you
read
can
the
answer
articles.
the.
I thought my
yeah.
knowledge was superior to that. I didn't have to do that, but
So they gave you the answers before you even took the test. You just got
well,
it.
yeah, if you just have to remember.
You just have to
them,
remember them. Yeah.
And speaking of pregnancy, patients are going to ask what kind of antibiotics do they need for treating urinary tract infections. Now, we tell people that come into the pharmacy, get raspberry juice or cranberry juice, or there is a cranberry pill that you can take that will help acidify the urine that will at least make the pain go away, but not necessarily cure the infections. And we used to have physicians write, I mean, there were females that had a low-grade urinary tract infection all the time, and they would put them on a prophylactic pill, just a low-strength antibiotic to keep that from occurring. But there was a recent report from the CDC that highlights the nitrofurantoin, which is either macrobid or macrodantin, or TMP-SMX, which is Septra or Bactrim, for over 40% of the prescriptions to treat a UTI in the first trimester, and questions about birth defects with some of these antibiotics. That doesn't mean they need to be avoided. You kind of do what we've said many times, risk versus benefit. So if you balance the benefits of antibiotics for UTIs and pregnancy, the nitrofurantoin in the first trimester is very weakly linked to heart defects and a cleft palate, but other data suggests no association. Plus, its long history of seemingly safe use in pregnancy is reassuring. It has limited resistance, too, which makes it a favorite. So they're saying there's a very weak risk of that. We probably use more of that than any medication for people who are pregnant in the first trimester. After that, it's not. But if what they're telling us, if we see nitrofurantoin used during most of pregnancy, including the first trimester, if necessary, because they're allergic to another drug with urine cultures, avoided in the last month of pregnancy due to the rare causes of hemolytic anemia in newborns. So the Septra or the Bactrim has more limitations. That TMP is trimethoprim in the first semester is linked to heart or neural tube defects, and the sulfonamide, which is the SMX, use late in pregnancy raises concerns about its dangerously high bilirubin in newborns. So they would advise that for the second or early third trimester. So the beta-lactams are generally safe throughout pregnancy. That's like cephalosporin, a wide-spectrum antibiotic that's related to penicillin, and also amoxicillin or ampicillin. So there's other options to be given for 3 to 7 days, and there's no good idea or good way to compare the efficacy of a 3 or 5 day versus 7 day. You want to avoid quinolones, which are those things like Levinox and ciprofloxacin. There's not enough data to say they're safe for the fetus. When they give us a choice with a ciprofloxacin or nitrofurantoin or Bactrim or Septra and Cenflexin, we would go with Cenflexin, which is good in any trimester of the birth process or the pregnancy process. Excuse me. There are people who aren't diabetic that get a high increase in their blood sugar when they take corticosteroids, things like prednisone, cortisone. Many diabetic patients taking oral steroids will have a blood glucose bump that can occur as easily as after the first dose. It can also happen after an epidural injection, because there are 3 things in an epidural injection that I have taken several times for my back, and it is usually fentanyl, and it's usually a steroid, and it's usually a pain medication besides that. So for the first 3 days, the short-acting drug works well, and then the fentanyl takes over, and the steroid acts as an anti-inflammatory. Well, there are people that have epidurals for different reasons, being pregnant, having back problems or surgery. The steroid used, doesn't matter which it is, the patient has, if they have type 1 or type 2 diabetes, the glucose control is something you need to pay attention to. In general, we don't recommend adjusting the diabetes meds or increasing glucose monitoring in most of those patients when they're on a short dose of steroids. Usually if you the epidural is a little longer acting, but the balance of that occurs in the very beginning. Where we see people that have a problem with it, they're coming in right after they've had started the steroids, and the steroids could be for an anti-inflammatory for the lungs, because a lot of people are asthmatics and have that problem, and they take the steroid, and they're also diabetic. But in general, that goes away after a period of time with a 10-day prednisone burst for, say, poison oak or poison ivy. You take one of those day packs. Tells you to take 8 tablets the first day, 7, 6, 5, 4, 3, 2, 1. There's no proof that small glucose bumps short-term are harmful, but hypoglycemia from increasing the medication can be. So that's the one thing you don't want to do unless your doctor tells you to, is increase the diabetic medications, because once that bump wears off, your blood glucose is going to be normal. So if you take it below normal, then you could be hypoglycemic, which means you could go into a diabetic coma, and glucose should go back to normal a few days after stopping the steroid. Situations that might lead to more significant glucose elevation, such as an underlying infection, you need to be careful if you're a type 1 diabetic. That's one that's on insulin, that they don't have any insulin secreted by their pancreas. And they need to probably check their glucose more often for, and also a poorly controlled type 2 diabetic that's usually what we call a brittle diabetic, and they have to be taken more often, and they don't respond every time to more of a insulin producing medication or something that's going to keep the liver from letting too much sugar out at one time. If you have a hyperglycemia, which is the too much sugar, the symptoms start as increased thirst, frequent urination, for a very high glucose, like over 400 milligrams per deciliter, and type 2s over 250 milligrams per deciliter, and type 1s. But for glucose bumps, like we're talking about for short terms, don't be surprised if you have a temporary increase in doses of insulin, such as 10 to 15%. If it's for more than just a short period of time, it's not going to hurt you. But we suggest in most cases don't adjust your insulin medication or your oral hyperglycemic medication if not necessary. Briefly, we talked once about this, a new substance that's going to come out to protect people that are on opiates that are taking Suboxone, and we mentioned that it was quite a bit more expensive than just Suboxone and Naloxone. It's not proven to work any better than the short-acting sublingual or under the tongue. The short-acting combos cost up to $500 a month, but the new long-acting one is $1,600 a month. So most people that have opiate abuse that are taking something aren't at the high end of the financial scale. So you must be stable on the sublingual or the buccal for at least a week before going to this other one. And if it's needed, and you look for patients that are long-term on the sublingual or buccal, and if they're starting to fail because it's not working, switching back to a short-acting combo alone, if the long-acting ones aren't enough, is not unusual to do. So it costs less than the once-monthly buprenorphine injection, costs less than the implant, and it will certainly be just as effective, if not more effective. Those of you who are on Medicare, you're going to get a new card and ID numbers, and you'll see advertisements on it all the time to help protect against identity theft and fraud. The new paper Medicare cards will be red, white, and blue, just like your Medicare card now. But instead of a Social Security number, they have a unique random 11-character ID number called a Medicare Beneficiary Identifier, an MBI. You need to watch for your new card in the mail. You're going to fall asleep wondering when it's getting here, between April of this year and April of next year. And to bring it so you can update your profile, and cards will be sent in waves based on location and other factors, so God knows when we'll be getting it in this part of the country. Your system, our pharmacy system, must be able to accept the new number by April 1, 2018. Since patients new to Medicare after that will only get an MBI number. With the new ID, as soon as you get it, be aware that CMS, Medicare, will accept the old or the new ID number through December 31st of 2019. Be careful about scams with people calling you or companies calling you claiming that you may pay or provide personal information to get a new card. You do not have to. Keep your Medicare ID confidential and destroy your old card when you get the new one. So just be aware of that at some time in the next year that you're going to get it, and there will be, if I know the government, there'll probably be 17 pages of instructions on what to do with it when you get it. Briefly, in the small time we have left here, poison prevention. There's unusual substances on the rise. We've talked about the Tide Pod Challenge. The Tide Pod Challenge, kids are being fooled by drugs that resemble candy or food, gummy vitamins, e-cigarette juice, marijuana cookies now in our wonderful state of California, iron tabs. National Anti-Poison Week is the 18th through the 24th of March, as a chance to raise the awareness and educate yourself about poisoning. Do you know what the number is, Paul?
It's 2222 or so, what is it again?
1-800
1-800
222
222
1222.
1222. I was close.
Yeah, well, close doesn't save your kid, you know. Well, I tried that number.
Well, we've
so-
got it. We've got it written on the little, on
On
the
the
door. No,
refrigerator,
it's actually on the door, on the where the sink is, where all the chemicals are at.
Yeah.
Yeah.
Well, explain that when you call that something's happened and you need to get help, keep meds locked up in a safe place, up and away and out of sight. Explain safety caps may slow kids down, but they also learn how to open them. So don't forget about adults. You need to educate them to turn on a light and read labels before each dose. I said to somebody that I live with yesterday, why don't you wear your glasses to read the paper? I don't know, because there's a drawer in front of me that has about 30 pair of eyeglasses in it. But she's, her arm isn't quite long
Sure.
enough
To get to that drawer.
Yeah. So we don't recommend trying to manage a poisoning with activated charcoal. We used to do activated charcoal, and we used to do Ipecac. Ipecac is no longer manufactured. We've had people that made their kids vomit up something that they stole a McDonald's sandwich out of the refrigerator and they wouldn't tell them. So they made them, they all said that they took it. So she made them all take the Ipecac until they all threw everything up
boy.
they had. And it wasn't a good thing for the Department of Health Services. So if you have any Ipecac around, get rid of it. If you still have it, you can do more harm than good. It's no longer being made. And dial 911 if you can't get anybody at the Poison Control Center. If they see someone that's collapsed or can't be awakened, is having a seizure or having trouble breathing. If they're not breathing, the Poison Center is not going to be able to help you. So that's a key when it comes to almost any kind of an injury that would keep that from happening. You need to put that number on the outside of a refrigerator or someplace where you can remember it. I'm not going to be here right on the 18th. I don't know what that Wednesday is, the 20th, I think, isn't it?
I have to flip my calendar over.
That's when you're going to be gone.
Yeah, I'll be
also.
gone that. It must be the 21st.
21st.
Yeah.
So we'll be reminding you after that. So I don't want them to get into any Irish whiskey or something like that on St. Patrick's Day.
No.
And that it won't be because
Heaven forbid.
Yes, it won't be as healthy for you as you'd be thinking it will.
Right.
You know? In
Yeah.
Ireland, we think that's what makes us healthy. We just keep a walking, but not going to be here for that. So I'm going to be in another part of the country. So I'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you. At 5136 Hill Road East, across from Center Lakeside Hospital. Call us there at 263-6192. And outside of the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.